Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle. September is Peripheral Artery Disease, or PAD, Awareness Month. And today I'm joined by vascular surgeons, Dr. Jason Crowner, Dr. Joshua Deering, Dr. Geetha Jeyabalan, and Dr. Lucy Kupersmith to discuss the risk factors, symptoms, diagnosis, and treatment options for this common disease. 1 in 20 Americans over the age of 50 have the condition, and it is even more common in African Americans, affecting nearly 1 in 10 over age 40. Early detection can help prevent multiple complications. So stick around, share this broadcast with your friends, give us a like, let us know you're watching. And if you have any questions for our experts, you can ask them in the comments. Before we get into our questions, let's learn a little bit more about our panel of experts. Dr. Jason Crowner, I'll start with you. Can you introduce yourself to our viewers?
Sure. Hey there. I'm Jason Crowner. I'm one of the vascular surgeons here at MedStar. I primarily work out of Good Samaritan Hospital and Union Memorial in Baltimore, Maryland. I would say that the focus of what I do is on PAD, or peripheral vascular disease, or peripheral arterial disease, and all the range of treatments of that, which include endovascular or leg angiograms and bypass surgery. I've been with MedStar for just had my 4-year anniversary about a couple weeks ago, and I've been a practicing physician for about 10 years.
Wonderful. Thank you. And happy anniversary.
Thanks.
Dr. Deering, can you introduce yourself?
Hi, I'm Josh Deering. I work predominantly at Southern Maryland Hospital, with also working at MedStar Washington Hospital Center. I've been in the area for about 9 years and been at Southern Maryland Hospital for about 7 years. There's a lot of patients with PAD in our area, and so it is something that we kind of take care of every day, along with every other vascular issue. And yeah, really enjoy being in the area and taking care of the patients down here.
All right, thank you. Dr. Jeyabalan.
Thanks for having us today. It's great to be here. I'm Geetha Jeyabalan, and I'm one of the vascular surgeons at Annapolis, Maryland, and that's where my primary practice is, although we offer services at Kent Island and Bowie as well. We're excited to let you guys know that we have a brand new ambulatory surgery center at which we're doing vascular cases, many of which include, PAD patients. And, I'm really thrilled to be a part of the larger MedStar network of surgeons. As you just heard, we have a diverse geography, so we can offer services to patients wherever they are. So that's kind of the big advantage that we have as a large, comprehensive healthcare system.
Yeah, absolutely. Thank you so much. And Dr. Kupersmith.
Hey there. So I am also one of the Annapolis MedStar vascular surgeons, along with Dr. Jeyabalan, and I also work over in the Kent Island office as well. So I love getting to help take care of folks both on the Eastern Shore and the Western Shore of Maryland, which is really fun. I do a lot of peripheral arterial disease work. I think we all do, as it is a common problem nationally and particularly in our area. And as Dr. J just said, we have a great ambulatory surgery center that just opened that I've gotten to do a few cases at, and it's just a wonderful facility. So we're really enjoying bringing all different types of open and endovascular care to this patient population.
That's wonderful. Thank you so much. All right, let's get into our questions. Dr. Crowner, I'm going to start with you. Let's set the foundation. What is peripheral artery disease and what causes it?
Peripheral arterial disease, or PAD, is a narrowing of your circulation or your blood vessels. And it's generally caused by atherosclerosis, which is kind of plaque buildup in your arteries that can lead to some narrowing. And then that narrowing basically causes or decreases the blood flow to your extremities, such as your legs, your feet, and then that can cause some symptoms of pain or discomfort when you walk or when you're at rest.
All right, thank you. What causes it?
So generally, peripheral vascular disease can be caused by a couple of things. The atherosclerosis of the plaque buildup in your arteries can be secondary to elevated levels of cholesterol or plaque in the vessels. You can also have peripheral vascular disease with folks that have diabetes or have some narrowing from having diabetes. And then things like smoking and lack of ambulation also play kind of a role in peripheral vascular disease.
All right, thank you. Can you talk about the symptoms of PAD? What are they?
So the symptoms generally are a constellation of things that we call claudication. So claudication is pain in your legs with ambulation that generally begins at a set distance. Usually this is resolved with rest. Most of the time, this set distance is the same every time. So it's 2 blocks, my legs start to hurt. Generally, that pain is described as a calf cramping or squeezing discomfort, kind of like a Charlie horse. As the peripheral vascular disease gets more severe, you can go from having claudication where that you get pain with ambulation or with walking that becomes kind of pain all the time or pain at rest. And this can involve your legs and or your feet and can lead to lack of sensation in your feet, lack of the ability to move your toes in your feet, and it can also lead to lack of wound healing with any sores or wounds that might be on your feet. So there's kind of a spectrum for peripheral vascular disease, but generally it starts with claudication or pain in your legs with walking.
Okay, thank you. Are the symptoms the same for everyone?
That's a great question. They are not the same for everyone, and there's a couple of reasons for that. The first being that it really just depends on how severe your peripheral vascular disease is or where you are on that spectrum. So some people really don't notice the achiness in their legs and can, walk a long distance before that pain stops them. Whereas other people have such bad pain in their legs with walking that they really can't do their daily activities. Along with that, it's been demonstrated, I think we're going to talk about this a little bit, that women generally come in with more severe peripheral vascular disease than men do. There's a lot of reasons for that, and we can kind of talk about that later, but a female might come in with pain in their feet already and state that the pain in their legs have been there for such a long time they don't even notice it anymore, but now their feet hurt at rest. And so the symptoms really vary very kind of along the spectrum. So it's always just an important thing to kind of keep an eye out for.
Okay. Can you have PAD without any symptoms?
You can. So one of the ways that we pick up peripheral vascular disease or peripheral arterial disease is through physical examination. And so when you go see your primary care physician, for example, one of the things they'll do is a physical exam where they actually look at your feet to see if there's hair growth on there, and then they'll probably feel for a pulse in your foot. If there's no pulse in your foot, then that generally prompts what's called an arterial duplex, which is a non-invasive ultrasound where they look at the blood flow. During that ultrasound, they can see if there's blockages in your arteries. And some folks actually have blockages in their arteries, but they don't have any symptoms. So you can definitely have asymptomatic peripheral vascular disease or peripheral arterial disease.
Okay, thank you. That was a great setup. Thanks, Dr. Crowner. Dr. Deering, I'm going to go to you next. How common is PAD?
So piggybacking off what Dr. Crowner just said, some people are asymptomatic, or have no symptoms. So it can be difficult to get a good guess at how many people have PAD. Right now, our best guess is that about 21 to 26 million people in the US today have it, which gives you about 6 to 8% of the population. But since it's such a big problem, it's important that we have this, September PAD Awareness Month.
Sure, absolutely. Thank you. So who typically gets PAD?
So PAD is typically a disease of older patients. So if you're in your 40s or younger than that, it's pretty unlikely that you have it, though there are some people who are at a higher risk in that group. Risk starts to get higher once you enter your 50s, and then even a little more once you're older than 70. So you'll notice sometimes your doctor may check for things once you're around 65. And then, as Dr. Crowner mentioned, there are some things that put you at a higher risk, like smoking, having diabetes, having high cholesterol, or having high blood pressure. So if you have any of those or some of those, your doctor may talk about this with you earlier than, say 65.
Mhm. Okay, thank you. Is there a higher prevalence of PAD in certain populations or ethnic groups?
So yes, again, we definitely focus on people who are older. So again, people that are older than 50, definitely older than 70, people who have a history of tobacco use. It's always great when people quit, but sometimes people have smoked for long enough that they've kind of increased their risk. Studies have shown that there's not a huge difference in the number of men versus the number of women. There's some slight variations, but there's not a huge difference. So it can affect either of those equally. As you kind of mentioned in the beginning, Black individuals have the highest risk. So in some groups, it can be up to 30% of Black people who have some form of PAD, whether that's asymptomatic or not. After that, Hispanic and Latino patients have the next highest risk, followed by white patients, and then Asian individuals having somewhat lower. There's not huge number variations in that. We're all kind of at risk, but that's kind of the hierarchy or the ranking of it.
All right, that's great to know. Thank you so much. Dr. Jeyabalan, I'm going to turn to you now to talk more about, we've set this up nicely, talking about the gender differences with PAD. Can you talk about those? We'll start with, do women present differently than men?
Yeah, I think our two prior discussants or speakers mentioned this already. And the reality is unfortunately, yes, women do tend to present a little bit differently for kind of a variety of reasons. I would actually say that it's very similar to heart disease in women. So women tend to be diagnosed at later stages. They often present with atypical symptoms. And a lot of times women tend to underreport their symptoms, and that can be due to a variety of reasons. They often have confounding other kind of disease processes like arthritis or neuropathy or spinal stenosis. And in women, because of certain healthcare disparities and biases within the healthcare system, a lot of times women tend to end up getting kind of taken down the path of other diagnoses like those with orthopedic surgeons and neurosurgeons to look at other causes. And so by the time they end up getting diagnosed with PAD, unfortunately, women tend to be kind of further along in the disease process. And at that point, they sometimes have more severe symptoms, as Dr. Crowner had mentioned earlier, and they tend to be older and already have more comorbid conditions or other pretty serious health conditions. So it is important that as healthcare providers, we kind of pay attention to women who have those risk factors, such as smoking, diabetes, family history, and so forth, and consider PAD as a potential cause of some of their symptoms.
Mm-hmm. All right, thank you so much. Are women more likely to get PAD than men?
So there's, studies that suggest that just in general, if you have a family member who had PAD or a history of heart attack or stroke, you're almost 2 times more likely to potentially be affected by that. But really what it correlates with is risk factors. So if you compare a woman and a man at the same age with kind of the same medical issues, if they both have a history of smoking and or a history of stroke or heart attack, women in that category tend to actually have a higher risk of having peripheral arterial disease that is significant. And women that are in their 80s or older actually tend to have a higher incidence of PAD than their male counterparts. And as mentioned earlier, there are certain demographic subsets, especially African American women tend to be at significantly greater risk, again, due to a variety of factors such as healthcare access issues, disparities in screening, and just one of the things that seems to be true for women as a whole is some of our risk factors for PAD, like high blood pressure, diabetes, and cholesterol, tend to not be as aggressively modified as men. So a lot of opportunities to change some of these, discrepancies that are currently in existence. But yes, unfortunately, currently that's how the differences are. So it's hopefully a good education for all of us as both healthcare providers and as patients to be aware of this difference between how women end up getting diagnosed and men.
Yep, absolutely. Thank you so much. That's really good to know. What about outcomes? Are outcomes any different for men versus women?
Overall outcomes, the only thing that we really have to base this on is the fact that, as I mentioned earlier, because women tend to present a little bit later on in their disease process, and sometimes they're already at the point where they may have a wound that's not healing, or they may have such severe lack of blood flow that they have pain even without walking. In those situations, once we're already presenting at that point, our outcomes tend to be less kind of satisfactory than patients who present very early, in whom we can say, hey, we can have you start a walking program, get you on a heart healthy diet, make sure you're getting your cholesterol under great control. Those patients that we catch early in the disease process can do wonderfully, and they can avoid getting to that advanced stage.
Yeah, I think that's the mainstay that Dr. J is talking about, is catching it early. And that's really what we promote with our patients and with all the providers we work with, is that if you have a concern for peripheral vascular disease in the setting of leg pain, I mean, just go ahead and order the ultrasound. It's a non-invasive test, and it's pretty easy to get, instead of, as Dr. J said, I think it's like everything else, back pain, arthritis, and whatnot. Getting it early is really the saving grace for this disease process.
Yeah, absolutely. Thanks for that information and mentioning that, Dr. Crowner. We're going to move to other risk factors now. We've had a lot of discussion about different your gender, your ethnicity. Let's talk about age. Dr. Kupersmith, does the risk for PAD increase with age?
Certainly, as we get older, we see more PAD in older populations, as Dr. Crowner and Dr. Deering were saying earlier. When you have been alive longer, you've had more years to develop issues related to that high blood pressure, longer times of high cholesterol. And so you certainly have a slightly higher risk of developing these kinds of issues, and longer for them to progress. But I think that, as Dr. J was saying, catching these things and identifying them allows you to increase that walking, increase that pain-free walking distance, have time to modify those kind of risk factors. So certainly we do see this in a lot of different age groups, but it does tend to be more prevalent as you get a little bit older.
Okay, good to know. Thank you. Is heart disease a risk factor? So if you have heart disease, are you at higher risk for developing PAD? And if so, why?
So a lot of that with heart disease, there's multiple different types of heart disease, but if we're thinking about that atherosclerosis that we were talking about earlier, that plaque building up in your arteries, you have arteries all throughout your body, and not just those arteries feeding your heart. So certainly if you're building up plaque in the arteries feeding your heart, leading to heart attacks and other issues like that, then absolutely you're likely building up some amount of plaque in the arteries throughout your body. And so that can certainly be a higher risk of developing PAD, or of already having PAD, whether you know it or not, or whether you've realized it or not. Certainly those folks who have those same risk factors, they're the same because it's the same disease process generally kind of happening throughout the body.
Mhm. Makes sense. Thank you. How is PAD diagnosed and what tests are used in the process?
So we always want to start with a physical exam, and that's always going to be our most important kind of first step. So we're always feeling pulses throughout the body, and then also listening to the sound of those waveforms. And we can listen in the office with a Doppler, just putting a little probe right on the arteries to listen to how they sound to us and the quality of that arterial flow. If we have concerns based on this, based on your history and what you're telling us, and then also based on that physical exam finding, then we would go to some more advanced tests. And we do a variety of different non-invasive tests using ultrasound in order to kind of get us to sort of that next stage of diagnosis. So one test that we use is an ABI, and that's an ankle brachial index. So for that, we check your blood pressure up in your arm, we compare it with the blood pressure down in your leg, and we make a ratio of those numbers so that we can kind of get an overall assessment of how much of the expected blood flow is really getting down there to the foot. We can check that pressure all the way into the tip of the toe as well, make sure that you've got enough blood flow to heal a wound if you've stubbed your toe or if you've developed a problem down there. We have various different types of ultrasound tests. Sometimes we'll do a duplex, which looks all the way along the artery, and we look at individual sections of it to look for any narrowing that we identify, elevated velocities that would indicate some sort of narrowing underneath there. And sometimes we do different waveform analyses throughout the leg as well. So lots of different non-invasive tests that we start with. In general, if we find that there is something and we combine that with the information from your history, maybe we've tried a walking program, maybe we've failed that, maybe, God forbid, you have a wound already, then we may move to some more aggressive, more invasive testing where we also have an opportunity to fix things. So one of the great things with vascular surgery is that we have a combination of open surgeries where we can bypass around a problem, or we also have endovascular treatments where we go in just through a needle hole and we can use diagnostic procedures inside the arteries themselves to take a look at what that blood flow is actually doing and try to improve it right then and there. So lots of different tests that give us different levels of information depending on what it is that we're seeing.
All right, thank you so much. I have one more question for you. Do you recommend screening for individuals if they're concerned about PAD?
I think certainly anyone who has these risk factors that we've been talking about, that family history, you can't change your family history. So certainly that puts you at risk, and folks with those issues, high blood pressure, high cholesterol, tobacco, absolutely. These are times and things that we want to take a look and see whether you have any kind of issues. One of the great things about our bodies is that we can do these physical exams. So a lot of times your primary care physician can actually really get a good upfront kind of test to say, do you have pulses? Can I feel your pulses? And we often see patients who maybe somebody else can't feel a pulse, but we have all these different pieces of technology to take a look and see even more detailed as to whether or not there's any kind of problem. So taking a look, it's always a good idea, particularly if you have those risk factors, that you can definitely start with that primary care evaluation, but then we can certainly see people to take a look at that.
All right. Thank you very much, Dr. Kupersmith. I'm going to take a moment now to welcome again our viewers who are watching. Thank you for joining us. Want to remind you that September is Peripheral Artery Disease Awareness Month. So today we've been discussing risk factors, symptoms. We just talked about diagnosis and treatment options we're going to get to. We're with our MedStar Health vascular surgeons, Dr. Jason Crowner, Dr. Joshua Deering, Dr. Geetha Jeyabalan, and Dr. Lucy Kupersmith. If you have questions for our experts, ask them in the comments. We'll get to those as well. So Dr. Crowner, I'm going to go back to you, and we're going to talk about a little bit more about how PAD can affect other health conditions. So my question is, Does PAD increase the risk for other health conditions, or can it make other conditions worse?
The shorter answer is yes. I think Dr. Kupersmith really touched on this, and I think that's important, is that folks that have peripheral arterial disease have a higher risk of coronary artery disease. They have a higher risk of stroke or transient ischemic attacks. They also have a higher risk of things like heart attack, which comes into the CAD or the coronary artery disease. And so they definitely all kind of go hand in hand. So, you know, it's the blood vessels that are being affected. And so we have, as Dr. Kupersmith just said, we have blood vessels everywhere in our body. And so it begs the reason that if you have plaque buildup in the arteries of your legs, you probably have a good chance of plaque buildup in arteries that feed your brain or feed your hearts. So if you have PAD, there's a really good chance you have all these other disease processes too. So coronary artery disease, coronary artery disease, um, you know, risk of heart attack, risk of stroke, or transient ischemic attack as well.
Thank you very much. Is there a way to reduce the risk of developing PAD in the first place?
Yeah, I think Dr. J kind of hit on this initially with her comments, and really the mainstay is early detection. So, you know, our recommendation for everybody obviously is if you smoke, stop. If you eat poorly and you have not been to a doctor to get your cholesterol checked in a long time, that's something you should probably do. So keeping your cholesterol in check or in balance, whether that's with medications or with exercise. If you have diabetes, kind of keeping that hemoglobin A1C under control, seeing your primary care physician on a regular basis. And then, you know, little things like exercise, not a lot of exercise, even just some routine walking. I would say somewhere between 3 to 5 times a week. If you could get out there and walk for 30 minutes, I mean, those are just fantastic things to do for your arteries.
All right, thank you. And some of the things you just mentioned may be part of your answer to my next question. But if you have PAD, what lifestyle changes should you make?
That's a fantastic question, and I think that this is the most important thing, is that if we do catch it early, I think there's a lot of things you can change that can help you long term and decrease the progression of this, or at least stop the progression of PAD. One of the big things, Dr. J mentioned, and I'll mention it again, is tobacco cessation, or quitting smoking. You know, tobacco is kind of like acid for your arteries. It doesn't do anything good for them. And so if you've smoked for a long time, if you can stop smoking, then you can negate or reduce some of that risk factors. Seeing your primary care physician on a regular basis, so eating a heart healthy diet, seeing them to talk about your cholesterol, and getting on medications or statins early to kind of keep that cholesterol in check. And then same thing for the diabetics, keeping your sugars in check. And then, as I mentioned just a few minutes ago, exercising regularly is really a big thing that can just really reverse the changes. You know, we see folks that come in with claudication or that pain in your legs when you walk that I spoke about earlier. If you can get on an exercise regimen, so you make some behavioral modifications and then you start exercising regularly. And when I say exercise, I mean walking. You can really increase that pain-free distance, so where you can actually walk further before the pain stops you. So those are just a few of the things, but this is kind of an open conversation with your primary care physician and your vascular surgeon, but there's a lot you can change.
Great, thank you so much. Let's talk about treatment now. Dr. Deering, I'm going to go to you. How is PAD treated?
So, you know, I think one of the interesting things is how we're all saying very similar things, and that's because PAD is very prevalent, and we all treat it kind of going back to these fundamental methods, which is always improving your risk factors. You know, as we've talked, a statin for your cholesterol is one of the best medications you can be on for PAD. It's really given us a lot of options and really prolonged people's lives, both from a heart standpoint and from a PAD standpoint. You know, some people have some fears about statins where they've heard that it can cause muscle issues, but in actuality, it's very few patients that have any side effects from statins. We also have some great new medications that treat cholesterol that we can help get you plugged in with your cardiologist that I've had a great success with. helping lower cholesterol, because one of the big things we want to do with PAD is going to slow down the progression and minimize any new plaque formation. So along with improving your diabetes, cutting back on smoking, we want to make sure you're on an aspirin or a medication like that. You may have heard of Plavix, which is similar to an aspirin. If you're asymptomatic, but you have PAD that's been diagnosed by a vascular surgeon or your primary care doctor, a lot of times that's just where we go. We just want to optimize you. If you have pain when you walk, we have a medication called Pletol. And what that does is it improves the way your blood flows in the leg. If you pair that with the exercise regimen that Dr. Crowner was talking about, we've seen tons and tons of patients get better. Some become completely asymptomatic after that. Some have just a big enough improvement that they're happy they can go back to grocery shopping, playing with their kids, playing with their grandkids without any problem. So Pletol is a fantastic medication, and we start with, medical things to treat that. If you have constant pain or if you have a wound that doesn't heal, we start to become a little more proactive. As Dr. Kupersmith mentioned, we can go in and take a look at those blood vessels. We have very minimally invasive ways of improving blood flow, whether that's ballooning things open, or even removing some of the plaque, things that we can do. And if there's more that has to be done, we can bypass around those blockages and give you good blood flow.
All right, thank you very much. So it sounds like there's different treatment options depending on your particular PAD and what works best for you, but a lot of great options out there. What about a cure or reversing PAD? Is there a way to reverse it, or is there a cure for PAD?
Unfortunately, there's not. We have a lot of great ways of managing it and minimizing it, but once your body is making that plaque and putting that plaque into your arteries, the best thing that we could do is slow it down. And while that kind of sounds a little pessimistic, most patients, once we have gotten them optimized with the exercise and the medications and their risk factors, those people go on to live long, healthy lives without any real problems in their lower extremities. So while we can't cure it, we are very good at keeping it from having a major impact on your life. And again, with everyone focusing on the early detection, it's great to discuss this with your primary care doctor, request a referral to a vascular surgeon within MedStar so that we can get you checked out and get you on the path to managing this, so that it's more of an afterthought than something that affects you every day.
Sure. Thank you very much. Dr. Jeyabalan, I'm going to go back to you. We talked about family history of PAD. Is PAD hereditary? Dr. Jeyabalan?
I think she froze.
Okay, can someone else answer that? Is it hereditary?
Can you guys hear me?
Yeah. Yes.
Okay. I'll give it my shot if it's a little dicey with the internet connection, but
Heard her for a second, but lost her again.
I have some of her answers actually here. If you,
Okay, go for it.
If she's having some, are you back?
okay. I'll try.
I'll
try one more time,
Yeah,
guys.
go for it.
She is.
So you were asking about PAD being hereditary.
Yeah, is it hereditary?
I think yeah. So So very similar to heart disease and stroke, there really isn't like a single genetic mutation that we can identify that impacts whether or not someone develops PAD. But we know there's kind of a cluster of genetic risk factors that definitely predispose people to developing PAD, heart disease, and stroke. And we know that if you have a strong family history of those things, heart attack, stroke, someone who's had issues with PAD, you are at a higher likelihood of developing it. And so in patients who have that family history, it is incredibly important to make sure that all of those risk factors that we were talking about, like obesity and diabetes, kidney problems, high blood pressure, lack of physical activity, all those things need to be even more tightly controlled than someone who has no family history of heart attack, stroke, or PAD. So that's the way I would frame that.
Okay, thank you very much. What happens if PAD goes untreated?
So I think Dr. Deering was mentioning earlier that the majority of PAD, if it's asymptomatic and it just happens to be found on physical exam or a screening test, such as an ABI test, for instance, a lot of times people get very alarmed and they say, oh my gosh, hey doc, I have a blockage in my leg. I went to another doctor and they told me I need to immediately have a procedure to unblock that blood vessel. And the reality is, actually, I know it sounds kind of counterintuitive, but that's not the first thing we want to do. Once we start tinkering with the blood vessels, we're going down a very specific path. What we like to do in those situations is we start off with good medical management with some of those medications, with statins, with aspirin, with diabetes control, and so forth. And then we start with a very serious, dedicated walking program so that people can start building their own bypass circuits around those blockages. And the vast majority of the time, if we catch this early enough and people do those types of interventions, then we don't need to go down the path of having to do angiograms and balloons and stents. I think the reason it's so important to go to a vascular specialist or a vascular surgeon as we are is because we recognize how important it is to avoid immediately performing potentially, risky interventions. And then when we do perform them, we have kind of all of the tools on the shelf that might be needed. Now, in some cases, if PAD is more advanced and if it is not treated, or if someone continues to have poorly controlled diabetes and all those other risk factors, it can lead to a variety of poor outcomes. It can lead to gangrene. It can lead to a wound not healing. It can lead to severe pain, even at rest. And, the worst case scenario is that it can lead to loss of a limb. And that is exactly what we are trying to prevent by making sure we're educating our patient population and our fellow colleagues on how to recognize this disease and how to manage it so that it does not progress to the point where we're talking about more significant poor outcomes.
Okay, thank you very much. Why is PAD typically underdiagnosed?
So we talked about this a little bit earlier when we hit upon the gender differences. So people tend to be older when they do develop PAD because it's kind of this slow process that happens chronically over many, many years. And by the time people are in their, 60s, 70s, even 80s, there's a lot of other symptoms that can sometimes masquerade and be similar to PAD symptoms. So significant arthritis, neuropathy, spinal stenosis, some of these other kind of symptoms that are caused by those other factors can mask PAD symptoms. And so it's not that uncommon that we'll see patients who have had a whole workup and even intervention for other issues like their back. And it turns out all along that really what may have been causing their leg pain or issues may have actually been PAD. So that tends to be one of the reasons why it might be under-recognized, because there's a lot of other similar things that can, well, I'd say different things that can cause similar symptoms. And so that's kind of one of the biggest challenges in diagnosing this disease.
Okay, makes sense. Thank you, Dr. Jeyabalan. Dr. Kupersmith, going back to you, how can our patients be better prepared to discuss PAD symptoms with their doctor?
I think kind of coming off of what Dr. J was saying, there are a lot of things that can cause similar symptoms. And one thing that's really helpful is to think about before you come in, what it is that provokes your symptoms. What makes your symptom feel better? When do you notice it? Does it happen all the time? Is it happening specifically when you're walking? Where in your leg are you feeling the pain? Is it your calf? Is it your thigh? Is it your buttock? These types of different things and other associated symptoms you might be feeling, all of those can help us suss out a little bit better whether it might be your arteries or whether it may be something else that's contributing to it. So I think that the best thing that patients can do when they're coming in is really think about those symptoms and think about what it is that they're experiencing. Try to figure out how far you can walk before you start to notice the symptom so that we can have good information with which to help our diagnosis.
All right, thank you so much. And what type of doctor treats PAD?
Well, obviously the vascular surgeons do, right? I think that it's really important when you're looking for a doctor for something like PAD to really make sure that you're trying to go to somebody whose entire training is focused on all of the different options to treat and manage these conditions. So a vascular surgeon is a board certified vascular surgeon has gone through specific training to look at the arteries. We're the plumbers. We work on all these pipes, right? And so going to somebody who has the full breadth of knowledge about this disease process, who can help coordinate different medical treatments and medical management with your primary care physician, with your cardiologist, all of those things are really important. And as Dr. Jeyabalan was saying, most importantly, if we can catch it and we can stay on top of it, with exercise and walking, we can often avoid any kind of intervention. So not just looking at the ultrasound, not just looking at one thing, but somebody who is going to be able to look at you as a whole person and look at what your symptoms are and help you create a long-term plan to manage this lifelong issue. So a vascular surgeon is who I'd say.
Mm-hmm. All right, thank you so much. I have one more question for you, Dr. Kupersmith. This is from an audience member, Diana. Thanks for your question. You talked about screenings earlier. She's asking specifically about, so if you have type 1 diabetes, for example, should you be thinking about getting screened earlier than, say, someone who doesn't have diabetes?
Sure. So with diabetes, one of the impacts that often has with relation to the arteries is it often starts with the small arteries down by your feet and your toes, and then almost kind of works its way up in a particular pattern. So diabetics should really make sure that they are seeing their primary care physician and often seeing a podiatrist to help make sure that they're not developing wounds or ulcers or things on their feet. Certainly coming in and having a vascular evaluation can be really helpful in terms of making sure, we can always screen somebody for any kind of peripheral arterial disease with those risk factors. But I think that the most important thing with diabetics is making sure that you are on top of that management of your diabetes with your primary care physician or your endocrinologist, and then also making sure that you're not having a wound or an ulcer that goes unnoticed on your feet and on your toes, as those can be really high risk factors for problems.
Okay, thank you so much for answering that question. And thanks again, Diana, for asking. We're going to go around now and get some final thoughts from our experts before we close today's discussion. So I'm going to start with Dr. Crowner. Dr. Crowner, any final key takeaways or anything that you want to make sure that our patients take away from today's conversation?
Yes, thank you. Just a couple of things, and we've kind of touched on all this. One is just that, talking to your primary care physician about PAD and getting that diagnosis it's not the end of the world. Coming to see us can be scary, but it's one of those disease processes that the sooner you get on top of it, the better the outcome is going to be. So if they recommend you seeing a vascular surgeon or getting an ultrasound, I definitely go for it. I mean, the ultrasounds are non-invasive, so they're not a risk at all. And then the second thing is just to kind of piggyback on what Dr. J said a little bit earlier, and that is that if you have asymptomatic peripheral arterial disease, and somebody is trying to do a procedure on you to fix those arteries, you should say no, or you should say, what's the benefit? How is it going to make me better? And I think that's just something that we tell folks to watch out for. Is, I mean, I love doing surgery, don't get me wrong, but there's kind of a time and a place for it. And if I'm going to do a procedure that's not going to actually make you feel any better, then it doesn't really make sense to do that procedure. And so just always be your own advocate, and make sure as a patient, you're asking, why do I need this procedure? Is it going to actually make me feel better? Is it going to help me? And know that just because you have that diagnosis of peripheral arterial disease, you don't necessarily need anything done. Sometimes it can just be all medical management. That's it.
All right. Thank you so much. Great advice, Dr. Crowner. Dr. Deering, I'm going to go next to you.
Everyone's brought up a lot of great points. I think with peripheral arterial disease, all of us became physicians because we like helping people, and we all became vascular surgeons because we find vascular surgery to be very interesting, and that's the problem we want to help people with. So I think we're very poised, interested, and trained to help you with this issue. So if you do have any questions, don't hesitate to come see us. We love taking care of patients. And even if, like Dr. Crowner said, we don't do surgery, that's not why we're here. We're here to help you. We're here to explain things to you and, guide you through this process. You just may need a medication and to take some walks, around Walmart or Target. You may need surgery, and we're kind of here to help guide you through that process. And it's something that we all feel very passionate about, and very lucky that we get to help patients with this.
Thank you. That's great. Dr. Jeyabalan, final thoughts.
Yeah, these are all fantastic points. And I think it's important to remember that we want to not only work with you, but also your team of providers. So as a patient, if you already are very involved with your primary care doctor, your cardiologist, your endocrinologist, then our whole goal is to share whatever information we're giving to you to those other providers, so that as a team, we can all work together to make sure that whatever is going on, whether it's PAD or it's a blockage in, the carotid artery, that we're all working together to get on top of that and to prevent that from getting worse. And so it's really great to see how healthcare has changed, and how this is a great example of how we're talking directly to patients, and that way patients, feel empowered to make sure that they're getting, their full spectrum of care that they deserve. So now hopefully you're all feeling better about knowing what PAD is, and it's not such a scary term, but also knowing what a vascular surgeon is, because I think a lot of times, folks kind of in the public don't necessarily know us as a specialty and don't know what we do. And it's great to be able to come directly to you to let you know that this is our expertise and this is what we do, and we do it well.
That's great. Thank you so much. And finally, Dr. Kupersmith.
So many good points that everyone has made. And I think that really just making sure that you, if you're having any of these kind of issues, that you go to somebody who does explain the process, who does make sure that you're understanding your own healthcare, making sure that you are asking those important questions of what are we doing? Why are we doing it? What is my expectation with this, either with the procedure or with the walking program? So making sure that you're really connecting with your physician. And we have so many fantastic vascular surgeons throughout the area, from all the way in DC, all around Maryland. So I think that there's, we've got a great group of vascular surgeons who are all here and ready to, help take care of those issues and help you be your own advocate to make sure that you are getting the care that you need.
That's great. Thank you all very much for the final thoughts. That wraps up our broadcast. Thank you again to our beautiful panel of experts. We appreciate your time and for joining us today to provide all this wonderful information to our viewers. If you would like more information on PAD or to schedule an appointment with one of our vascular surgeons, you can visit the link in the comments. We'll put that out there for you. Thanks again and have a wonderful rest of the day and happy PAD Awareness Month. We'll see you next time. Bye-bye.